Well, welcome back to Thomas McDowell and his 3 locations, which you'll mention. We're going to talk about a number of things that are seasonal issues.
Yep.
Thomas, welcome. And again, starting 2026, we want to give you the information, but we want also, if you have questions that we can assist, we would welcome that opportunity too, because you may be sitting there having an issue, and if that's okay.
Yeah, absolutely.
Now that's my persuasion. But Thomas, take it off. Tell us where we are.
Thank you, Roger. We've talked about this topic a little bit, but wanted to get into more of a comparison between some of the common illnesses, especially respiratory illnesses, cold, flu, COVID, RSV, trying to help folks differentiate between those. I think everybody's pretty aware that the flu is rampant right now, and we've dispensed more Tamiflu in the past few weeks than we have in the past several years. Last year was a pretty mild flu season. This year has been much more severe. Urgent care, hospital, primary care, they've been flooded with flu cases, lots of positive tests. So it's really hitting home with folks, but in the mix of that is also still COVID, RSV, and the common cold that we've had for years and years. And it's hard to tell the difference between all of those and what you should do and how you should try to treat it. So we're going to go through that and kind of go line by line on some of the symptoms and whether
that's wonderful. That's good.
So we've got, common cold typically is relatively gradual. Fever is rare. Usually you don't have significant body aches and chills. Usually you're having more of the upper respiratory sinus symptoms. It's usually not getting into your chest. And it may be a little bit of cough if you have some postnasal drip, but not severe cough usually. Usually no shortness of breath unless you have some underlying conditions, and 5 to 10 days. So if you're on that mild side with no fever, and again, there's a lot of blend between these illnesses, so take this with a grain of salt. I'm not guaranteeing that you don't have flu, COVID, or RSV, but that kind of outlines the common cold. Gradual, fever's rare, aches are mild to none, nasal is mild, more allergy type symptoms sometimes.
Just very uncomfortable.
Yeah, just kind of feel a little crummy, but not bad. Usually no shortness of breath and relatively short duration usually, unless you develop into a sinus infection, which is, can be viral or bacterial. And then so moving on to the flu, really, really specific point on the flu. Sudden onset is very common. Sudden, rapid onset.
In other words, all of a sudden, boom.
You go from feeling fine to feeling like you got hit by a bus.
I hear that true.
Although that being said, I have had a couple of cases that I've seen that were more gradual, that were flu A. So just to muddy the water a little bit, it's not guaranteed. But eventually on the flu, even if the onset is not extremely rapid, you will feel usually pretty darn bad with the flu, whether it's rapid or a day later. But usually sudden onset, usually have a fever. You typically have body aches and chills. You can have some nasal congestion. You typically will have some cough as well, and can have sometimes a sore throat, and it can develop into shortness of breath. Usually a week duration. It's just usually much more severe than the common cold. Now, if you've had your flu vaccine, depending on whether they, kind of made a good educated guess on covering the right strain, that can make the flu less severe, which can make it more difficult to know if you have the flu. But that's describing the flu. COVID is really difficult because it is a blend of all of these that we're talking about. Sore throat is common, scratchy throat as an initial onset symptom is common. gradual or rapid. It can be either. You can have fever and mild body aches. You can have nasal. You can have shortness of breath. Duration is 5, to 10 days. The COVID is still differentiated by mostly if you lose your taste or smell is you don't have that on flu, RSV, or common cold. So that's still out there, and that can help identify COVID. RSV is usually more chest and lung related, gradual onset, sometimes a fever, sometimes nasal congestion, but very often you have maybe a little bit of wheezing or tightness in the chest or some chest congestion. And can be up to 2-week duration. So if it's a real long duration, it could be.
Flu is usually 5 or 6 days, isn't it?
Usually you feel really bad, but it will pass usually. Now, if you're elderly or young, it can hospitalize you and even cause death.
Yeah.
So especially if you're immunocompromised. But that's kind of the differences between all of those. Obviously, the only way to confirm for sure is the test. At Medical Park Pharmacy, we do have COVID and flu. There's COVID and flu combo test out there right now, so you can test at home and pick up those over the counter. RSV has to be done at the doctor's office. Common cold doesn't really have a test.
Is that like a pregnancy test?
No, they're usually a nasal swabbing you. And you can have some false negatives on those tests. If you don't get a good sample, if you don't have a lot of viral shedding in your nose or a lot of congestion, you might not get a good sample. A false negative is usually more common than a false positive. So if you get a positive on one of those tests, it's usually accurate. But if you get a negative, it could
go either way.
Could be either way, yeah. So don't discount it. If you have a fever, especially, you're typically contagious.
So fever is a good sign that
you have something.
You can pass it on.
Yeah, and usually it might be more than just the common cold. So be careful if you have a fever. So testing is typically the only way. Treatment-wise, there's treatment out there for the flu and Tamiflu and a couple other options. Tamiflu you really need to jump on within 48 hours of symptom onset. It doesn't work unless you actually start it within 48 hours.
So getting the test in the pharmacy is the best place, right?
Well, that's a quick way, and if you do come, call us and we can bring it out to your car.
Yeah.
So we can
put that on page 1 because this is outhouse work. It's safer for you and for everybody else.
We want to minimize the spread, so if you call us, we offer curbside service. You can park in front of the pharmacy and we can bring it out to you if you call us. But yeah, the Tamiflu's got to be started quickly. Tamiflu can also be used prophylactically, preventatively. So if you have a family member that's tested positive, you also can take Tamiflu to prevent getting it from your family
Precautionary.
member. So that's an option too if you know that you've been exposed as well. And Tamiflu is not going to just knock it out immediately. It typically reduces the duration by 1 to 2 days. So it's not a miracle worker, but it can reduce 7 days to 5 days worth of symptoms, which is beneficial.
I'm sure it is.
RSV doesn't really have a medication that can be used. There is an RSV vaccine for ages 60 and older that we have at the pharmacy that's covered by most insurance plans. We still have some flu shots. It's never too late if you want to get one. That's your choice, but we do have them. And it still would protect you through the end of the season, which is through May. We can see flu all the way up until April and May. So it's not too late. COVID, there's vaccine if you choose that and want that. There's also a couple of medications. They are expensive, but there are a couple of medications that can be used to treat COVID. The common cold is symptom treatment only. Cough medicine, allergy medicine, RSV.
Some of that can be over the counter.
Yep, RSV is symptom treatment only. Over-the-counter options, and any of these, if you're having significant breathing issues, shortness of breath, extreme fever, any of these things, you need to talk to your doctor about it, because it it can develop into pneumonia, viral or bacterial pneumonia, and we're really worried if you're short of breath or wheezing. That's when we're starting to worry.
I actually saw someone from Scotland Neck last week, and he was on oxygen, and I said, David, what's going on? He said, it just happened. He said, it just happened.
Yeah.
He said, I went from being fine, all of a sudden I was having real difficulties.
Yeah, it can be fast, and so don't ignore the breathing issues. That's where we're really concerned. A lot of people ask, how long am I contagious? When can I go back to work? And obviously that's up to your employer's policy, and but in general, you're contagious while you have a fever, usually, especially if you're coughing, because most of these are spread through respiratory droplets and close contact. But usually 24 to 48 hours fever-free without fever-reducing medications. So if you have a fever, but then you're taking Tylenol to reduce it, and then you don't have a fever, that doesn't count because you still have the active virus. You're just suppressing the fever. So you want to be fever-free 24, 48 hours or so, and that greatly reduces the risk of spread. But you also want to see symptoms improved or resolved after that too, before you can feel a little more comfortable, with trying to reduce that spread.
Well, I have been in the last few weeks, a couple people that I know had flu, and their difficulty was the coughing.
Yeah.
They
been a lot of coughing this year.
One lady said, I coughed, and it just hurt.
Your ribs are sore.
Yeah.
Yeah. There's been a lot of flu A, and the coughing's been more significant than even what I've seen in the past on the flu, where the coughing is it's with you even well after you're fever-free.
Well, the schools around here, I know Rocky Mountain Academy and Faith have been just dominated. I mean, athletic teams and everything are about half masked.
Yeah, it spreads fast, and we're hopefully going to get through the worst of it. But it's been a rough year, for flu so far, and it varies year to year. And so do what you can to minimize that, spread by. Knowing that if you have a fever, you're likely contagious.
Yeah. Well, Thomas, you have somewhere else to be this morning, so we're going to be a few minutes shy of what we typically do, but in respect for that, I'll let you close and say anything that you would like to do, and then you can go achieve your task.
Thank you, Roger. Well, if you have questions about these respiratory illnesses, call us at the pharmacy, Medical Park Pharmacy. Our number's on the screen, 9 to 5:30. Those are our hours. We're at the Boyce Willis Clinic, Medical Park Building, 901 North Winstead Avenue. Full service pharmacy, so we're really accessible. Call us. We pick up the phone when you call us, unlike maybe some of the big box stores, and we have to leave a voicemail or stay on hold forever. So we'd love to help you. If you are sick and needing something over the counter, we'd love to help you. Just call before when you get there, and we'll bring it out to your car. And we also have our location in Scotland Neck, McDowell's Pharmacy. New location in Gates County, also McDowell's Pharmacy. So we're excited to be branching out, and we really would love to serve you. If you're looking for a new pharmacy this new year, we'd love to be your local pharmacy, and we try to treat our folks like family. Just remember this year, new insurance cards, deductibles, new copays. Last year's copays and last year's insurance might be different than this year's copays.
They are.
This year's insurance. So we get a lot of questions about that. Be patient with your pharmacy. They want to help you.
Or your doctors or anyone else.
Yeah, everything usually, especially on Medicare, resets this time of year. So more to come on that. But call us if you have questions about that. We'll be glad to help you. Thanks for your time.
Well, Thomas, we appreciate it. Hope you have a great day and a great year. And with that, we'll go to our thank you to the vendors.